you. How do I find my notes? Thank you.
You should joust.
Oh, do we go back? Oh, that's all right. I've got some here. Anyway, and then I'll go on, I think, there after this page. Okay. Hi, everyone. Thanks for having me, and welcome everyone in person and online. Can you hear me up the back okay? Yep, great, thanks. So yes, my name's Sophie. I'm a prostate cancer specialist nurse at the Royal Adelaide Hospital. I've worked there since 2018, supported by the Prostate Cancer Foundation of Australia, and I work across the urology, radiation oncology and medical oncology departments, supporting men and their families with prostate cancer. So I really like the theme of tonight's session, taking charge of your health. I do talk about that a lot with the chaps that I see. So tonight I'm going to discuss how you can do this in regards to finding information, education and support, whether you're newly diagnosed, have disease recurrence, or just want some reliable information about prostate cancer. Okay, so I'll just do here. I'm sure you all know how to navigate a website. So the first great place to start to finding information about prostate cancer is the PCFA's website. So pcfa.org.au, and across the top here you can see awareness, support and the online community, which is what I want to talk about tonight. So on the PCFA website you can find information books, which you can see here, and I'm sure a lot of you have seen them or been given them already. There are 15 of them, including a guide for newly diagnosed, surgery, radiation therapy and health and wellbeing, to name a few. You can read them online or they are printable, and I'm sure many of the doctors' offices have them to give out as well. 8 of these different books are being translated to other languages. Actually, it's 8 other languages they're being translated to, sorry. Also, the online community that you can see on that other page is Australia's largest online group dedicated to connecting Australian men and families who have been impacted by prostate cancer. You can also join the conversation in the online group. Sorry. I'll just go back there. I've got to go down here. Join the conversation in the online community forum, learn more about medical and scientific breakthroughs in the research blog, and check out what the experts think in the video gallery. That's a really great resource which covers topics like incontinence, sexual function, and just living well with prostate cancer. So yes, it's a great resource to help you take charge of your health. You can also keep up to date with the latest research, treatments and community events by following the PCFA on your favourite social media network. So another way of taking charge of your health is through the support and connection with others. Knowing you are not going through this life-changing situation on your own has many benefits. Support groups can also be found on the PCFA website. There are 130 PCFA support groups around Australia. So these support groups bring together men and women who have a passion for helping those impacted by prostate cancer. Most members of the network have had a direct experience of prostate cancer, either as a patient or as a partner and family member. The PCFA also have a range of prostate cancer peer support groups established around the country. These include for men with advanced prostate cancer, culturally and linguistically diverse groups, gay, bisexual groups, partners and carers of men with prostate cancer groups, and younger men with cancer. So please take the time to have a look at these groups online if you're interested. So support groups provide an opportunity for people to share their experiences and feelings with others who are in the same boat. They can provide encouragement, optimism and inspiration, relief from fear and depression. Studies show that support groups can enhance members' self-esteem, improve relationships, and gain confidence to face the future. There are many support groups across South Australia as well. Visit the website to find one in your area. You could also call the group leader, which you'll find the details on the website, and find out what happens in that certain group. Many of the support groups meet on a monthly basis and have speakers present on many different aspects of prostate cancer. So if a support group is not your thing and you'd like to talk to someone, the PCFA Mates Connect service is another great support option. Mates Connect is a telephone-based peer support service for men affected by prostate cancer. The Mates Connect service can connect you to a trained volunteer who understands what you're going through. All of the volunteers have been through prostate cancer. You can get practical advice on treatments, the side effects of treatments, such as incontinence, erectile dysfunction, or coping with androgen deprivation therapy. Call the 1-800 number to be connected with a prostate cancer survivor volunteer. So, prostate cancer specialist nurses also assist men to take charge of their health by providing information, education and support. A prostate cancer specialist nurse is an experienced registered nurse who has received additional training to make them an expert nurse in prostate cancer care. There are currently around 100 prostate cancer nurses in various locations around Australia. We currently have 7 in South Australia, in country areas as well, down in Mount Gambier, and on the up Wallaroo, and now I've had a mental blank anyway, but there's 7. You can find us all on the website as well. All right. The prostate cancer specialist nurse service has been made possible thanks to funding from the federal government and generous local and community supporters. We work within a framework to ensure you receive the same level of care from your nurse no matter where you live. Most major hospitals around the country have a prostate cancer specialist nurse. So what do we do as a prostate cancer specialist nurse? We provide support and information at diagnosis, support with treatment decisions, weighing up the pros and cons of if you've got localised prostate cancer, the pros and cons of surgery and radiotherapy. We provide a point of contact during treatment and beyond. We help with side effect management of incontinence and erectile dysfunction. I'm referring you to the other experts that you'll hear about from tonight. Provide support when the clinical situation changes. I have men ring me 3 years down the track and say, Sophie, my PSA is rising, what do I do? Some nurses provide nurse-led follow-up care. We support with survivorship issues, and we help promote awareness of prostate cancer and education to other healthcare professionals and the community. And some of us are also involved in research. So, if you've been diagnosed with prostate cancer and are not connected or met a prostate cancer specialist nurse in your health service, the PCFA's specialist tele-nursing service is available to all men, both in the public and private setting. The nurses can help you understand your diagnosis, treatment options and side effects. They just do it over the phone. They offer other relevant practical and emotional support tailored to your prostate cancer needs. They can also link you up with local support networks, including support groups and prostate cancer specialist nurses in your area. So the number there, 1-800 number, which is on the website as well. So counsellors or psychologists are experienced health professionals helping people affected by cancer. If you feel you are not coping, take charge of your health by reaching out and getting the support that you need. Counsellors and psychologists can help you learn new ways to manage stress and all that being diagnosed and living with prostate cancer can bring to one's life, like living with uncertainty, fear of cancer recurrence, depression and anxiety, sexual difficulties, relationship difficulties, and the list goes on. So once again, if you feel you're not coping, please reach out, and the support is there if you need. So the Cancer Council, we know, has a well-established counselling support line. You can access this by calling their number, 131120. The Prostate Cancer Foundation are actually launching a new cancer counselling service as part of Men's Health Week, and that's actually being launched tomorrow. So that will be available to men with prostate cancer and their partners and family members, so that those details will be on their website as well. So that service will be available for those that aren't connected with a health service that have counselling and psychological support. Obviously, there's other great support resources out there as well, which you may have been had a look at. There's Cancer Council, Relationships Australia, Continence Foundation of Australia, Beyond Blue, Men's Health, Men's Line Australia, Carers Australia, Palliative Care, and Lifeline. And I've probably missed some, but there's some excellent supports out there. So my take-home message, take charge of what you can. There's a great video on the PCFA video library, and I always remember a psychologist talking about the 5 things that you can take charge of. One is sleep well, which you'll hear about tonight. Eat well, which you'll hear about tonight. Exercise, which you'll hear about tonight. Take time to do something for yourself. Slow your mind down, do some meditation or mindfulness or whatever it is that helps you, and then hang around people you like. That was the 5th thing, I always remember that. And get rid of the people out of your life you don't like. So that all is a overall well-being, yeah. So yes, there's many options for information and support. Please, you don't have to go it alone, and we're all here to support you. Thank you.